Good afternoon, and thanks for joining today. Today you will hear from Governor Tim Walz, Minnesota Department of Health Commissioner Jan Malcolm, State Emergency Management Director Joe Kelly, and the Minnesota Department of Employment and Economic Development Commissioner Steve Grove. As a reminder, reporters, please limit yourself to one question each with a single on-topic follow-up. And with that, Governor Tim Walz.
Thank you, Teddy. Good afternoon, Minnesotans. Thank you once again for joining us. We start off by noting we had 4 additional fatalities, bringing our total positive COVID-19 tests to 1,069. Commissioner Malcolm will go into some of the details on that, but I want to, again, thank all of you for taking the time to listen, and I can't stress enough for being willing to make these incredible sacrifices. We are seeing some pretty strong indications that we're pushing that curve back, we're bending it a little bit, and we're giving ourselves exactly what we needed to do to give time to reassess where we're at, to make adjustments, and all with the intention of keeping as many Minnesotans safe as possible and attempting to return our lives back to a semblance of normalcy as quickly as we can. So with that being said, this is a month of a lot of very important religious celebrations. This is a very important week for many of us of the Christian faith, and with Passover starting and Easter and then Ramadan coming on, I know this was very challenging. These are opportunities to spend with family in larger gatherings, centered around food in many cases. And I know for me personally, my mother-in-law, Lynn Whipple, has played the organ at Bethany Elam Lutheran in Ivanhoe, Minnesota, for as long as I've known her, for many decades, and it's a part of our family tradition too. So I hear Minnesotans on this. I'm hearing from the religious community, from many of my neighbors, from legislators, about figuring out ways, if there's a way that we can social distance and be able to honor our traditions. We're continuing to work on that, but I would just remind people the best thing we can do is the social distancing. The best thing we can do is be smart about how we go about our daily business. We may be eating dinners with just our immediate families, but I would remind people, as you're more maybe be out shopping, keep those distance rules. CDC and Commissioner Malcolm, and I am adhering to this. I got my opportunity to get outside with my dog Scout of wearing a cloth mask with the idea of protecting others if that is what comes on. So we hear you on this. We know it's an important time, but I ask you to keep in mind that we simply want to keep the progress we're making going. And with that, I do want to say a thank you to the legislature. I'm watching very carefully this afternoon. They are working. They are doing a fabulous job of coming together to find solutions for Minnesotans. And today they were doing some workers' comp legislation around first responders and frontline workers, making sure that if they fall ill with COVID-19, they'll be taken care of. This is really a critical piece, making sure people have that safety net there. Really proud, bipartisan amongst the legislators, labor leaders, business community, our administration, all working to find an agreement. We weren't able to get an agreement yet on the funding mechanism, but there's a lot of trust in one another, and we're sure we're going to get that to make sure that we get that piece of legislation right. So I'm really looking forward to signing it. It's my anticipation that that'll be to my desk this evening to be able to sign. Also want to highlight incredible public-private partnerships that are continuing to be built. I highlighted a few of our companies working the other day, but today I'm pleased to announce that Cub Foods has partnered with our Children's Cabinet to set up an ordering process specifically for child care providers. This ensures that child care providers have access to all those things they need available at convenient locations, flexible hours, and they can continue to do their job. That's from food to cleaning supplies to things for infants that they're going to need to get. So I can't tell you that it partners together two heroes of this pandemic, grocers and child care providers. So thank you for that. Thank you for working together to make that happen. And these partnerships are absolutely the heart of why I believe Minnesota is doing things a little differently, getting a little bit different results, and I think have a different plan going forward. So very, very grateful for Cub Foods for stepping up. I'd also like to mention that in the midst of this, our state is multitasking on many fronts. And I will soon be signing another emergency executive order that puts the National Guard soldiers on duty in response to spring flooding up in Marshall County. We're keeping an eye on the Red River Valley and others, but that's the one as of today. And as General Jensen, the Adjutant General of Minnesota National Guard, mentioned in briefing me on this yesterday as we got ready to activate these troops, this is the second year in a row that the Minnesota National Guard will be spending Easter Sunday with our neighbors in Osseo and in Marshall County, and we're there to serve. So please know that the capacity of the state to respond to other emergencies is there. To carry about our daily functions that the state government needs to do, they are doing that. And a shout out to Commerce Department, the Public Utilities Commission, and the public-private partners again. They put out an urgent call and an ask of our electric and gas utilities to voluntarily commit to not cutting off heat or power during this peacetime emergency, and over 100 utilities stepped up voluntarily to do so. I want to applaud them for their commitment to their neighbors. I would certainly encourage all to do it. I know that it's a financial challenge for all of you, but with the federal help and the state help, we'll make sure we get this right. And I had a call this morning with our entire federal delegation, working on issues together, talking about what the next COVID support bill would look like. These members are highly engaged in their individual congressional districts, and then, of course, the senators across the state, but they bring that federal perspective and connections that we really need. So I appreciate that. And before I go to Commissioner Malcolm, this idea of working together, of solving problems, and the theme that I talked about, Minnesotans step up to this. I know there's a group of folks out there that when the COVID-19 came along, there are so many different issues that people are dealing with. One of them was the affordability of insulin. That never went away. This is still a critical issue for many of our neighbors. And I'm pleased to tell you that I know that you maybe heard this a lot of times, but in this moment of unity, in this moment of problem solving, I think we're going to get there in the very near future on an emergency insulin bill. And that's a lot of credit to a lot of people, from the activists to legislators on both sides of the aisle to folks inside the administration. So it's some good news there. And with that, I'm going to turn it over to Commissioner Malcolm for a little bit of an update on the specifics.
Thank you, Governor Walz. Good afternoon. For a quick situation update on the data, the global total as of early this morning was just a little under 1,500,000 cases globally, almost 76,000 deaths. The United States is reporting just under 370,000 cases this morning, 132,000 in the state of New York, almost 70,000 in New York City alone. The United States is reporting just under 11,000 deaths as of this morning, just under 3,500 in New York City alone. Our hearts continue to be with our colleagues in the New York area. In terms of Minnesota, as the governor mentioned, we are now reporting a total of 1,069 laboratory-confirmed cases in Minnesota. That's an increase of 83 over yesterday's total of 986. That was on a testing volume of about 1,100 tests yesterday. Monday is always our lowest testing day following the weekend, when most care provider sites are not doing testing. And as the governor reported, sadly, we confirmed 4 more COVID deaths for a total now of 34 in the state. All of these most recent 4 were residents of long-term care facilities in their respective communities. A little bit more detail there. One was a Dakota County resident in their 60s, a Winona County resident in their 90s, a Hennepin County resident in their 90s, and another Hennepin County resident in their 80s. As of today, 549 patients have been released from isolation following being tested positive for COVID-19. As of today, there are 120 patients currently in the hospital. So that's about half of our cumulative total over the course of the outbreak so far. 64 of the 120 today are in intensive care. I'd like to just mention a couple of specific topics of focus. One of the ways in which we're trying to track the effectiveness of our slow the spread efforts with our fantastic epidemiologists at the State Health Department is to look at the rate at which COVID-19 cases are doubling. That is a kind of a key metric that tells us where on that curve we are and whether we're starting to see the exponential growth. We're happy to note that Minnesota so far is seeing a slower rate of doubling than we might have anticipated at this point. In the first few weeks of March, we were seeing the Minnesota case total double every 1 to 2 days. However, since the week of March 18th, which is about the same time we started implementing some of the broader community-wide mitigation steps, we saw that doubling rate slow to once every 8 days. And that's the pace we've maintained since then, according to our latest data. That's good news for our state. It tells us that the social distancing and other mitigations are having a positive impact. We need to keep this up so that we can reduce the chance that our healthcare system will be overwhelmed by a surge in cases. And we do urge all Minnesotans to keep up this good, though difficult work, even during the religious holidays, as Governor Walz has already mentioned. I'd also like to comment again today about the relationship of COVID-19 and health disparities. We're getting a lot of questions, and they're excellent questions, about how COVID-19 is impacting Minnesota's diverse populations. Over the weekend, we started sharing available information about the case totals and deaths by racial demographics. However, that early data is quite limited and doesn't necessarily give us much to go on. As I had mentioned before, a significant portion of the cases do not self-report race or ethnicity, or it's unknown. What we can say, based on other information we know about COVID-19, and I think I've mentioned this on prior calls, we know that the risk of severe illness goes up for those with underlying health conditions, such as heart disease, severe asthma, diabetes, and the like. We also know from our years of work on health equity that some populations in Minnesota, such as African Americans and American Indians, suffer significantly higher rates of certain of these conditions, which means that we absolutely expect and know that COVID-19 can disproportionately impact those groups of Minnesotans. It's so important for us to work together with these communities to make sure that people in these populations who are suffering from underlying health conditions have the best available information about how to protect themselves and their families. We've been working on this with community leaders, and we'll be doing even more in the days ahead. With that, I'll conclude today's report and turn it over to Director Kelly.
Thank you, Commissioner, and good afternoon, everyone. Just a quick update today. The State Emergency Operations Center continues to be a very busy place, as you can imagine. We are supporting the procurement team as they acquire needed supplies and equipment. The alternate care site group is conducting their last 2 days of site visits. Our IT technicians this afternoon are adding content to the website and the dashboards to give Minnesotans more of the information that they want to understand what's going on. The state hotline room operators continue to answer dozens of questions and concerns from the public each and every day, 7 days a week. Our work with FEMA and our local emergency management colleagues continues. Today we held another statewide webinar to share information and maintain that all-important coordination between all levels of government, from the federal level all the way down to the city level. You might recall I mentioned last week that we're not immune to natural disasters or other incidents just because we're fighting the virus, as the governor announced earlier. The National Guard will put some soldiers on duty to help the city of Osseo patrol their levees and their other flood protections, as well as be ready to evacuate or rescue citizens if that becomes necessary. Now that flooding on the Red River has made their town an island, and with the recent precipitation, the flood charts show that the water is going to remain high for probably the next 10 to 14 days. These are very busy days, but please rest assured we're all leaning into the work to get Minnesota through this, and we'll meet whatever challenge pops up next. Now I'm going to hand things off to Commissioner Steve Grove with DEED. Commissioner?
Thanks, Director Kelly. Hello, everybody. This week, a big theme of our work at DEED is focused on strengthening our state's unemployment insurance program. We've been removing barriers to get more people the benefits they deserve. We've opened up our call lines to get people more in-person assistance this week, and we've also really ramped up our resources in languages other than English so that folks from all backgrounds can come in and access these benefits really effectively. Thanks to the governor's executive order of yesterday, last night, we were able to clear all 45,000 of those stuck applications in our queue on that eligibility issue. So we were able to move quickly after the governor cleared that pathway for the team. The call center was very lively yesterday. We took about 7,000 calls yesterday. That's, just to give you a perspective, about 800 calls per hour that the line was open, and that's about 13 for every minute. So very busy team answering calls. Again, we really do encourage folks to go to uimn.org, but are going to continue to keep that call line open, even with some longer wait times when people want an in-person touch and have a question answered that they can't figure out on our website. The team's working really hard, continue to expand hours and help every person in the state get the money they deserve as fast as humanly possible. We are up to, since this crisis began, 355,108 applications as of last night. Just to give you a perspective on that, that's about 11.4% of Minnesota's total labor force, which is up 8.2% from last week. So that's not an unemployment statistic, obviously, because those folks aren't searching for work, and many of them are just temporarily furloughed or laid off. But it just gives you a sense of the scope of those numbers. 11.4% of our labor force since this crisis began has applied for unemployment insurance benefits. Yesterday, we saw 13,424 applicants in the queue. Monday is usually our biggest day in unemployment insurance. That number was down from the previous Monday and the Monday before that as well. So we'll continue to track if numbers trend downward. But it's still a lot of applicants, obviously, but it was smaller than last week. And then we wanted to provide some clarification around the CARES Act $600 top-off payment, because we're just getting a lot of questions about that, obviously, because it's more money than most people would get in a given week for unemployment insurance. We are still waiting on guidance from the federal government, but I just want to reassure Minnesotans that you don't have to do anything proactively to get that benefit. We will automatically add that $600 payment to you for every week that you're eligible, and we will backdate it to everyone who is eligible beginning the week of March 29th. So I know there's a lot of concern out there about getting that extra money. It makes a big difference, and that's why we're working tirelessly with the Department of Labor to get that guidance. But please rest assured that you're not going to lose days of payment overall, and that you don't have to do anything extra to get it. We will proactively reach out to you. Once a week, we like to give an update to people about the demographics of unemployment insurance. And, you know, we know that obviously unemployment insurance in this crisis hits different groups harder than others. And this week, I wanted to share some racial data around unemployment insurance. We have seen that since March 16th, 19% of people of color, Indigenous, and Latinx people in the labor force of Minnesota have applied for unemployment insurance benefits, compared to 9.5% of the white working age population in the labor force in Minnesota. So those disparities exist in unemployment just as they do in health, as Commissioner Malcolm said a moment ago. And so given that, Dee's doing a couple of things under the direction of the governor and lieutenant governor to focus on this challenge. The first, as I mentioned before, was just making the system as usable as possible for all kinds of groups. So those translations to Spanish and Hmong and Somali are important. We're also doing a lot of outreach efforts in communities of color, connecting with organizations and community leaders, ethnic media, radio and television stations, just to help people understand how to use the system. That's important. But more importantly is finding other ways to prevent unemployment from happening in the first place, obviously. And so as we have built up our small business emergency loan program, we've been very specific to choose lenders in our network that focus on communities of color. And I'm happy to report that thus far, nearly half of the loans that we've authorized through our state small business emergency loan program have gone to lenders that exclusively serve business owners of color. So we expect that trend to continue just based on the network that we've built there. And it's just one of many steps that we are going to continue to pursue to ensure that we're helping those most affected by this challenge make it through with some assistance from the state and from the federal government. Just a few more demographic details. By age group, we're seeing numbers of claims rise slightly for those above 55, decrease a little bit for the younger age groups, but still younger age groups dominate the number of claims that have come through. We are also seeing the gender balance kind of even out at this point, where about 50.4% of applicants are women and 49.5% are men. So that original jump from kind of 66 to 33 female-male split has kind of evened out to about 50-50. And then we're seeing continued increase in the number of applicants for people with less than a 4-year degree. In terms of industry, we're seeing, accommodation, food service, healthcare kind of go down this last week compared to other occupation categories. And I think that's just because some of those have kind of maxed out. And then transportation, warehousing, information, and public administration have risen somewhat this week as new groups have been affected by the crisis. So that's a lot of data on unemployment insurance. We wanted to give you a picture of how that is all playing out. And lastly, just to, again, thank the business community in our state for all that they're doing to help us through this crisis. We were really grateful to see a group of business owners over at Minneapolis's famous Midtown Global Market come together to launch a GoFundMe campaign in support of Meals for Medics. They raised about $14,000 to help serve meals to the medics over at Abbott Northwestern Hospital. Just a great example of a bunch of small businesses coming together to raise some money for the healthcare providers in their neighborhood. So we're grateful for businesses like that and many others across the state who are helping serve our healthcare community when they're on the front lines doing the great work that they are. With that, I will turn it back over to the governor.
Well, thank you, commissioners. And as you can hear, we're continuing to move forward and lean into this. We're adjusting fire on this target daily. As new data comes in, we want to move forward deliberately and as well informed as we can. And we want to make sure the partners in this fight, the people of Minnesota, are as well versed as possible on what our plans are, what is changing, what's needed, and more importantly, I think of progress towards that goal, protecting our neighbors and moving back towards a sense of normalcy. And with that, I'll open it up for questions.
Operator, we're ready for questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. Again, that is star 1 on your telephone keypad. Your first question comes from the line of Emily Havoc from KARE11. Your line is open.
Hi, Governor and Commissioners. I have a question. You did touch on the religious holidays coming up, but more generally, we have heard from multiple people saying there are still church gatherings being held. Do you have any response to that? And could you clarify? I know your order lists faith workers as critical, but it doesn't appear to list faith gatherings as exempt. Can you just touch on that and give a little clarity?
Yeah, absolutely. And as I've said from the beginning of this, all the components, the physical, the mental, the financial, the psychological, and the spiritual part are important, and we're trying to make considerations for this. And I think exempting these folks that are there, that are providing counseling, that are providing services for folks, that was the intention. We don't want the large gatherings, and I know that there is a sense of fellowship that goes with these. I know especially on the high holy days that we're seeing coming up this week and later this month. We're still encouraging people, to try and be creative. We've seen where people have tried to do things outside now with social distancing between them, but we certainly don't want people gathering in large numbers in closed spaces or being in contact with one another. And so that's part of the executive order. It's part about keeping people safe. I think to keep in perspective of this, of nearly 6 million Minnesotans, I think I saw we actually had 8 incidents where the police needed to step in and chose to write a citation across Minnesota. Minnesotans are following the rules on this, but I can't stress enough, I know the temptation, especially around these important holidays. We are trying to work with religious leaders to figure out ways that we can make sure that they're as meaningful as possible and that we have that sense of fellowship and worship, but without having people put in danger. So I would reiterate to people again, gathering in large numbers in the church, we simply don't want that happening, and that was part of the order. We do want you to figure out ways that we can continue to exercise your religious freedoms in any way you choose that doesn't endanger the safety of others.
Thanks, Governor. And just to follow up, has there been any action taken, or are you considering any action on the churches that might still be holding services? Would those be included in any of those?
Yeah, I get a brief from this, and I don't have Commissioner Harrington on with me. I get a brief of where some of these are, and people have to use their judgment, and law enforcement and folks have to. I know that there was one that was fairly openly said they were going to defy this, and they chose not to. So At this point in time, I don't have any details of where people are saying that it's happening, they're doing it. If we get those calls again, I would, just to reassure people, it's not to get people into trouble. It's to get people out of trouble, namely getting them out of situations where people could get sick. So at this time, no, I don't have any specific issues that we're dealing with.
Thank you, Governor.
Your next question comes from the line of Matt Sepik from Minnesota Public Radio. Your line is open.
Hi there. This question is for Commissioner Malcolm or Chris EHRESMANN, if you are on the line, Chris. I'm wondering how many or what percentage of the completed tests that are in your count are related to health workers who have been tested as a precaution, and if that may account for Minnesota's relatively low rate of positive results compared to other states. And then the other part of that question is anyone keeping track of presumed COVID cases for people who may be ineligible for a test but are otherwise exhibiting symptoms?
Chris is on the line as a resource, so Chris, I'll ask you to answer the question about the healthcare worker data in specific.
Okay. So we are collecting information on the individuals who have tested positive who are healthcare workers, and at this point, that number is 296 of our cases, and in the process of identifying these individuals, then we do a very thorough assessment of their potential exposures, both between healthcare workers, with patients, all of those things. And so we've got a pretty strong effort to make sure that healthcare workers who may have been exposed are put into quarantine and follow-up. So I do think we have a really strong team that's working on these things. Did that help to answer that question?
Yeah, so 296 cases, those are people who have tested positive. How many healthcare workers have been tested overall? I'm just looking at the overall count of tests, whether they're positive or negative.
We do not get information on the individuals. We get information on the negative tests, but we do not get specific information on those individuals. So we can't comment, that of the 1,000 tests that were run today, X number fell into the healthcare worker category. But I can tell you that we have a very robust team that follows up on any healthcare worker positives and any potential exposures from healthcare workers.
Okay, and then my other, continue, sorry.
I was just going to say to your other question about presumptive cases, there's a group called the Council of State and Territorial Epidemiologists, and they have been meeting to put together a case definition for presumptive cases so that we would have a way to look at some of the cases that are identified but are not tested. So we will be looking at that, but at this point there hasn't been a standard case definition, so it's not something that we could, count in a meaningful manner in the absence of that.
Okay, gotcha. You got to know what you're counting first. All right, thanks.
Your next question comes from the line of Tim Nelson from Minnesota Public Radio. Your line is open.
Got a quick question for the governor and Commissioner Malcolm. We're seeing reports of shortages of healthcare workers in other states, and some states are bringing back retired or non-practicing doctors and nurses. I know both the boards here in Minnesota are looking at that issue and the clinical requirements for relicensing, and say they're talking to the Walz administration. What's going on with that? Is that something we can expect will happen as the cases rise here?
Yeah, thank you, Tim, for the question. We are discussing. Jan, I'm going to give it to you as you're in the negotiations.
Yes, I think we're very, very focused on the workforce part of this equation, that as we're trying to build up added capacity for the surge, it's about the physical sites, the hospital beds, and specifically the critical care beds, and then beyond that, the equipment that's needed to support the respiratory therapies needed, the ventilators and similar kinds of things, but it's also the staff to to support all of that. So I know that the health systems are doing a lot of work to try to understand how they can redeploy healthcare workers from other parts of the system and give them the training that they need to fill in some of these roles. But we do believe that tapping the volunteer spirit of currently licensed professionals who've registered with Minnesota Responds, the volunteer base that are willing to be deployed where needed, is so very helpful. But as well, kind of working on both ends of the spectrum, if you will, the retirees who might be willing to come back into practice for this crisis, as well as looking at folks who are just ready to graduate, have fulfilled all of their training requirements, and how can we get them really quickly into the field. So we are definitely looking at what kind of regulatory support we may need for both of those efforts.
And Commissioner, do you have any sense how many people you're talking about here?
I don't have that off the top of my head. We can probably try to get you an estimate of what that potential labor force might be in the coming days here. I'm sorry, I don't have it right now.
Thank you.
Tim, I'll follow up too on that, because I thought this was important, because it seems maybe pretty confusing to your listeners out there. When I was talking to several of the health CEOs over the weekend, there were stories about nurses and doctors being laid off, and people were saying, what's the deal with that? We've got this surge coming. I thought we were doing all this to make sure that we could do this. Well, not all of them work in the areas that were needed, and many of them, those were elective surgery areas, and because of the finances around hospitals, they needed to furlough these people, and they were using their sick time or whatever they were doing. But many of those, if not all those health systems, are retraining as many of those people as possible, just like the commissioner said, to try and fill these spots. So we're trying to get a handle on these numbers too, because obviously we could do the best job possible. We could build up ICU beds. We could have ventilators in each of those rooms. And if we don't have the people there to manage it, that's not going to get us anywhere. So we are approaching this from a lot of different angles. I think the biggest thing for people to understand is we're working hand in hand with our private nonprofit healthcare providers who have ways to manage their own workforce. We're trying to look at across the entire enterprise of healthcare in the state and match those and move them around. So your question is very well taken. It's one of the areas we're looking at bringing folks back in. But we also think there's a whole lot that are already in, ready to go, and just simply need to be assigned. So thank you.
Thanks.
Another question from Betsy Singer from Kaal TV. Your line is open.
Good afternoon, Governor and Commissioners. I think this question is more for Director Joe Kelly, possibly KRISTEN. People who call 911 for non-COVID-19 emergencies, gas leaks, health issues, callers are being asked new protocol questions by 911 operators. Some are worrying that this is delaying our emergency crews responding to their calls. So how do COVID-related questions, when callers call a 911 dispatcher, help first responders before they go to a scene? Does it change how they respond or what they show up in as far as what they wear?
Yeah, Joe, if you want to take this and maybe Jan get on this, it's a great question, Betsy, and it's one that your final part of your question about how do we get that data while still protecting the public's privacy is one that we have been discussing. But I'd like Joe, if he has some information on how first responders are taking these calls.
Sure. Thank you, Governor, and thank you for the question, Betsy. I'll do my best to answer it generally, and we can get back to you with more specifics. I have not heard, and the emergency communications is in a different part of public safety than I work, but I haven't heard that yet, but I do know. What I do know is that first responders are concerned about what they are responding to, and they want to make sure that they can respond with the right people and be properly protected so they can deal with whatever problem the person is calling and asking for help with while still protecting first responders. But I will follow up with the Emergency Communications Network and ask what they are seeing from the 911 centers.
Yeah, and it's Commissioner Malcolm. I'll just, I think Joe answered it quite accurately. I think the intent there is just to make sure that if anyone in the household has symptoms consistent with COVID, that information can be shared with the first responders so that they can act accordingly. I've not heard a concern about that changing the response in any way in terms of timeliness or the like. But we just are encouraging everyone, all callers to be sharing as much information before they go to their healthcare provider when they call for emergency response. It's just really important that callers do share that information with their healthcare providers, whether those are emergency responders or their regular physicians, so that appropriate precautions can be taken.
Commissioners, Governor, thank you so much.
Next question comes from the line of Tom Hauser from KSTP-TV. Your line is open.
Hello, Governor and Commissioners. This question is for Governor Walz and Commissioner Malcolm. Are you familiar with a new website by the Carlson School of Management at the University of Minnesota tracking hospitalizations? It's a really great website where you can click on any state and find out how many people are hospitalized, how many are in ICU. Their goal is to make this easier for states to maybe share resources from one hotspot to a place that maybe isn't a hotspot. And so a quick question about how helpful that might be to the state. And then also, a lot of people who drive by our big hospitals and hear anecdotally from people in those hospitals that they're not crowded right now, that they're not seeing the type of caseload like we see in New York and places like that. Do you want to urge people not to get into a false sense of security? Is that surge coming? And I'll open it up to the Governor and Commissioner.
Yeah, I know Jan's going to echo as quickly as she can. Yes, about the false sense of security. You should, and again, this is a line, and Jan and I talk often about this. There's a desire and a need for an optimistic, over-the-horizon solutions that we're providing. And there's every reason for us to share when we're making progress, which we are. Some of these numbers, and even anecdotally what people are saying there, are looking pretty good right now, but it will come. Now, I say it will come if certain things don't happen. If therapeutics come along, if we get some breakthroughs, if our social distancing. So I do want people to not have a false sense of security, but I also want you to take away from this, what we're doing is working. And we have a chance, if we get this right, to avoid the worst of the things that you've seen happen in certain places. And then, as people said, we're going to still have to deal with this in the situations where it comes up. Going to the Carlson School and that data gathering, looking across, absolutely those things are helpful. I talk to several governors every day, and I just mentioned that's FEMA's job. And when, again, I don't want to get in this because I do not care about why we ended up at this point right now. There will be a time to understand that, and then we will care. But a federal coordinated response is meant to do that. And I think we're seeing that a little better now of moving to hotspots. But what we're interested in is not reacting to hotspots, but predicting hotspots and building for the front of them. Mayo Clinic is starting to do some analytics right now that's very cutting edge, that we think could buy us up to a week in the state of Minnesota to predict hotspots in the state to do exactly what you're saying. So the stuff, the data set that Carlson is putting out, it's how you use that data. We were talking this morning, data can inform you to the questions you should be asking, leading you to those questions you should be asking. And that kind of holistic picture is exactly what we need to be doing. We're trying to do that at the state level. So, Jan, I hope I echoed loudly enough your don't get a false sense of security message here. So I'll turn it to you.
Yes, thanks, Governor. You certainly did. I'm not personally familiar with the Carlson website, but we'll take a look at that. But I think the Governor's right. Any picture that we can get that helps us understand what's happening with our peers is helpful as well. we do, and I think I've mentioned this multiple times in the past, the amount of information sharing that's going on within the state is really, really impressive in terms of our ability to know what's happening all around the state. Tom, your point about the hospitals not being crowded yet, and maybe we thought they would be by now. That's certainly, we've talked before about different models that are out there, different projections about when the peak might come. We do believe that the community mitigation efforts have helped to slow the growth in cases. We think we're seeing that in our data. We might have expected, I know some of the models predicted that the peak would have been here in Minnesota by now. Clearly, that didn't materialize quite that way. Some of it, we think, due to the success of our efforts. But again, we continue to prepare for and expect that we are still on the early end of our curve. And while I'm personally really gratified to see the growth rate staying kind of in a stable zone, I know that could change any day, and that we're likely to see much more rapid increases over the next few weeks here.
Governor, quick follow-up for you. I understand you're out of quarantine but still working from home. When you do venture out, do you plan to wear a mask out in public, as the House Speaker did today when she was working on legislation on the House floor today?
Yes, I absolutely do. And I was out yesterday, Tom, at the dog park with my pup, and I had a mask on. I did notice there was only a couple of us that were doing it, and I think it was one of our folks on here, maybe Dave over at Pioneer Press, wrote a story about you feel a little awkward the first time you do it. We're used to making eye contact and smiling, but I think it's important to do it. The CDC put that out. Commissioner Malcolm has reiterated that, so yes, I will be wearing it and asking my family to do so.
All right, thank you.
Next question is from Dave Arick from Pioneer Press. Your line is open.
Hi, thank you, Governor. I'm not wearing my bandana right now.
Speak of the devil there.
Thanks for wearing yours. You're going to have to make a decision, obviously, on whether we continue the stay-at-home order. And you've said all along data is going to inform you. I'm wondering two things. One, what are you expecting? When are you expecting to hear from the university modelers? And can you talk a little bit about the narrative that has developed that is coming out of the Washington University Medical School model, which shows a much milder outlook than the university one, and maybe how that's going to factor into your decision?
Yeah, it definitely will, and it is one of those data sets, Dave, is that first we talk health providers, experts, epidemiologists, economics, state economists, and others, the business community, large and small, others, and then taking into factors the psychology and talking to social scientists about what is possible and how do you do that. We started looking at that data set last night. I have spent the better part of the last 24 hours going through that in the books that I have from all the sectors. And we use those other models too. And I think what we're seeing is that we have far more information. Even it seems almost impossible to me that it was 2 weeks ago when we did the stay-at-home order, and what we've added to that. So those things will come into that. I do think you're seeing, and we will put this information out. I'm hoping that we're ready to go by tomorrow in some pretty great detail, and then start building off of that with our partners. As I said, that continuing to adjust fire. That I think what we've learned is there's ways that we can continue to refine how we go about this, and that is exactly my goal to figure out, threading that needle with the safety of Minnesotans in place, but using all of those points of data to have us ask the right questions. And I think our strategy is even becoming sharper, but very similar to that I laid out 2 weeks ago, that we bend the curve, we build up our supply, we get ready for that fight, we continue to isolate those that need to be the most isolated. We ramp up testing, both on antibody testing and rapid testing, and we get as many people back into the workforce in an orderly manner as we can. And I think what you'll see, Dave, is we'll start laying that out tomorrow, and I think the modeling is starting to there's still going to be a confidence interval that goes on both sides, and I want to be very careful in talking to Minnesotans about explaining exactly what you can get out of this data and what you can't. But data and all of these models point to trends, and I know people are drawn to what the end number is. It was never meant to necessarily predict fatalities. It was meant to predict actions and behaviors if you don't do anything, worst case scenarios. So I think you can expect tomorrow we'll start laying this out. We'll be working with Minnesotans, but I think you get a feel for where we're headed on this. I think there's a Minnesota way to do this, and I think there's a way to save all the lives that we need to save, and to have that hospital capacity there while starting to think about ways to get people smartly and focused back into it. But again, I would caution, and this is where Commissioner Malcolm always, keeps me in check on this, is this is working because people are basically complying and doing the things they need to. None of that would change in terms of, we would still expect them to comply with things that make a difference. So tomorrow, I think we're prepping to try and to kick this off, and then it'll be ever evolving over the next week or so as we get closer to how it's going to look.
Okay, thank you. When just a little more specificity, when you say you're going to kick this thing off tomorrow, what exactly can we expect tomorrow?
I'll make a determination. I think it's already pretty clear that we will continue with heading down our stay-at-home order, but using the data to refine that in a way that makes sense. So I want to get back. We have to make a decision. The federal government and everyone else is looking into May, first part of May, and our data, as it starts to show, I think the commissioner said our peak has been pushed out some, and I want to start talking to Minnesotans about that and what I'm going to ask of them to do. And we're not going to give up on the things that are working, but I think we can add more things that work to that, and that might be an changing list of things that we're able to add in or to do, and again, having to adjust to make sure that we don't strain that system. So at this point in time, I think we've been given, maybe by geography, I'd like to think it's by a social compact amongst all of us, and some good decisions made both in government and out of government have bought us probably more time than any other state, and I just want to use it wisely. So we'll talk more on it tomorrow.
Thank you.
Next question is from Darren Svensson from KTOE Radio. Your line is open.
Thank you, Governor. You just mentioned on some of the things that may get talked about tomorrow on the stay-at-home end of things. On the economic end of things right now, a person that's sitting there out of work and doesn't have a job to go to right now, like 11.4% of Minnesota's workforce that has applied for unemployment, some of them will see the positive numbers, like Minnesota having the lowest per capita rate of COVID infections in the nation, and Minnesota's rate doubling every 8 days instead of every couple of days. They may wonder, why can't I go back to work? What would you tell folks like that?
Yeah, they're right to wonder. What I would tell them is, perhaps, and maybe you can't, and that's what we're trying to figure out without risking what we've done. I mean, the best case scenario in this is if we avoid what happened in New York City, we avoid the Italy situation, and we're able to get the care, that's a great situation. But I want to be very clear. I am deeply aware of the economic pain that leads to social pain that can lead to health pains for people and issues. So I think what I would tell people is thank you for doing what you've done. This wasn't just by chance. This was a very deliberate, and it was a very well executed by the people of Minnesota to get us into that point. I'd also say we're testing about right in the middle. So these numbers I think they're apples to apples. But I am still very nervous about the lack of testing. But I also think what we're seeing is many things can change. You think of what's changed in 2 weeks and how much we know and things that are starting to move and what we don't know, which is always good to know what we don't know, asymptomatic transmission and those things. But what I would tell those people is stick with us on this. We are doing the best we can. If there is any possibility at all of getting you back into that workforce without increasing the chance of spread or tapping out our healthcare system, that is what our intent is to do it smartly. And that is listening to a whole bunch of different data points. But I think first and foremost, this is a success story of Minnesotans choosing to do this. Now we need to decide how do we thread that needle accurately to keep the positive health news moving, while we also then start to ramp the economic side of it. And again, there's a lot of ifs in this, and the biggest unknown is the capacity to get that testing up to the volume that it needs to be. That is the single biggest sticking point to getting us back to where I think a lot of us want to be, where we're able to do the activities we wanted to.
And a quick follow-up, I'm reading between the lines, which is sometimes dangerous and might not be the fairest thing to assume in this situation, but when you talk to us tomorrow about an extension of the stay-at-home order, will it be a rubber stamp to what we've been under the last couple of weeks, or will it be something different?
Well, and I'm not a cliffhanger guy, and I try and get it out. I just don't want to get ahead of my team before we've finalized all of the final things that we're looking at. I think what you could expect is we will continue to do a lot of the things that we're doing that are making a difference, but with a roadmap and a set of directions that I think will allow us to start move in a refined manner, and that will be ever moving. So it's not like we're putting it in place tomorrow and that's it for the next 2 weeks. Nothing else is going to happen. It's going to be a more of this hard look at these things have worked really well, and we think the data shows that we can also make a few other things work really well. So I'm not trying to be coy on this. I am just not all the way done with my briefing or having the experts walk me through some unexpected things that we saw. We had shorter hospital stays, less fatalities, but we had a higher R-naught in the numbers, which means the transmission from one person to more than one person was higher than originally expected. So there was a lot of good data, but there was also some concerning data. So I'll get into it a little more tomorrow, but I'm not trying to play coy with you. I think what you can expect is we'll continue doing a lot of the things we're doing, but I think our plan will be much more refined, and I think that's what a lot of Minnesotans are asking for, that we get it, we did what you asked. Now, is there ways that we can do some other things that still keep us moving the right way?
Thank you, Governor.
Operator, we have time for one more question today.
All right, our next question is from Scott Peterson from Minnesota News Network. Your line is open.
Hi, Governor. Thank you for taking my question. Our neighbors in Wisconsin having a primary election today. I'm curious, what are you doing or what precautions are you taking to ensure that we don't have a situation similar to Wisconsin where we've got voters lined up potentially risking their health so that they can vote in the primary?
Oh, well, amen. Thank you, Scott, for the question, and you can rest assured I was speaking with Steve Simon yesterday, and I'm just thankful we have really smart folks in elections. I know that there's discussions happening around election security and election help that will be, I hope, I can't speak for the legislature, but we hope they take it up on the 14th when they come back into their next session. And we're looking out again already. We can't have a repeat of that situation. There was a lot of uncertainty, and now I'm looking on TV and I'm seeing lines of folks lining up to do something that's very important in a democracy, is free people casting their vote. So we are working on it. We're looking at it. We will, again, we have the advantage of other states did it first, and that is one of the things we're using to inform our decision, is watching things that have worked elsewhere and haven't worked elsewhere. So we'll make sure that Minnesota's in a position that we talk about all of the potential alternatives, from mail-in voting to changing the dates or whatever that takes. So I want to thank you for the question. It's really important. And again, before I close today, I'm incredibly grateful, and I'm threading that line that a lot of the things we're trying to do are working because Minnesotans are doing exactly what was asked. So I'm grateful for that. We can continue to all try and do a little bit better, but I think the biggest thing is that seeing 60 and 70 degree weather and the desire to get out and be with our neighbors. I saw the NPR story on the Powderhorn neighborhood in South Minneapolis, where at 7 o'clock everybody goes outside and they social distance, and then they start singing. So they've done, I See You Are My Sunshine and Let It Be. They share song selections, and I saw on here that potentially they're taking requests. So, if you're out there listening in Powderhorn, I'd love to see a neighborhood rendition of Bruce Springsteen's Cadillac Ranch. So we'll talk tomorrow, everyone. Keep up the great work, and we'll continue to share as much information as we can. Goodbye.
Find more local news stories at ccxmedia.org and follow us on social media.